By the end of this video, you'll be able to identify and correct the 3 most common standing postures that create knee pain for women, especially runners. Hi guys, it's Chris with HealthyConsumer.com, back with another episode of Working Body Wednesdays. I have my lovely wife Danielle with me here. Working Body Wednesdays is where we look at posture, functional movement, and ways to harden your body so it's more able to cope with the demands of daily life. So first things first, guys, the most important thing to recognize is that the foot is the first thing to hit the ground. So if you don't correct the foot, then nothing else up the chain, whether it's the knee or the hip or even the low back and beyond, is going to be correct, and you could have issues. The knee is the unfortunate guy that takes the brunt of a lot of foot and ankle problems or hip problems because it's that joint that's in between. And even though your knee is primarily a hinge joint, it also has a little bit of ability to have some rotation. So Danielle happens to have higher arches. If you're somebody like me and you have flat feet that like to fall in, then that can also create a force at the knee and all the way up into the hip possibly as well. So just standing with Danielle, what I see most commonly, and this is something that I see with her sometimes if she's not thinking about it, is that she has a lot of mobility at her knee joint. And a lot of females are this way as well. So a lot of people like to do what I would call passive standing, where they just lock their knees back. And in women, if you take a side view, Danielle, it would look more like this. She doesn't have as extreme of what we would call genu recurvatum, where the knees lock back and then you just hang out on the knees there. What I encourage people to do is just gently soften, so lock them back all the way, and then just unlock the knees just a little bit there. Perfect. And by doing that, then you can get into the muscles a little bit more. When I have her standing, go ahead and turn back towards the front of the camera. I would ask that she is about hip distance apart, so she has a straight line all the way from her hip crease down through the center of her kneecap and out through her second toe. If she's way out wide, if she's very narrow, then she's not going to use her hip muscles correctly. It's important to note too that the 2 parts of the leg, the upper leg, the femur bone, and then the tibia and the fibula come together at the knee joint. And what happens with a lot of people is, let's say for instance Danielle was flat-footed. What would happen is, as that rolls in, you can see that it creates a rotation at the knee. And it also creates this torquing force here, where this part of your lower leg is rolling in, where this is relatively rolled out. So if you're a runner, or even if you just have flat feet, I highly encourage you to correct that first. Make sure you have proper orthotics and you're working on strengthening the intrinsic, the small muscles of the feet. So sometimes I give people the cue of reaching down through the inside of the heel as well, so that they're grounded through there. That actually creates a connection all the way up to the glute medius up on the side of the butt there, and through the base of the big toe as well. So that's where the majority of the weight should be. Instead of, especially if you have high arches and you're somebody that likes to roll out like that, you can see I have a mark here on Danielle at her tibia plateau and how that changes everything at the knee. If you lose that orientation at the foot, it creates that torsional force at the knee. A lot of people get destruction at the knee because of the twisting forces more than anything else, and you call that a tibial torsion. So it's important to correct the foot. You should be right through the center of the joint. You should be active through the foot. You suck up the arch slightly so it's active, especially if you're somebody that has flat arches. You make sure that you are standing equally on both legs, that you don't do one of these where you lock one knee back, you bend the other knee, and that creates a lot of hyperextension at the knee. And again, we're locking out on those bones and you will wear that knee out faster. And you can see here that again is going to, if her kneecap is right here, here are the corners of her kneecap. You can look at that bottom tick mark there and you can see her tibia plateau is nowhere near the center of her knee. So she's created a great twisting force and all her angle of force is going out through this angle of the leg here. So she's creating a great deal of bowing at the leg. So it's very important to have your weight on both legs to gently soften the knees slightly and then to be reaching down through the inside of the heel. Her weight is back on her heels, so she's not standing way out in front on leaning forward. Go ahead and take a side view there, Danielle. So she's not way forward and hanging out there. Her weight should come right through the side of her hip, through the center of her knee, and out through the side of her malleolus. And that's another episode of Working Body Wednesday, guys. Check back every Wednesday for more videos like this. Subscribe and hit the little bell so you never miss another video. Thanks a lot, and I look forward to seeing you next Wednesday.